It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives, changing lives, changing lives for the better, changing lives.
And hi again, everyone. Jim Knox along with Candace Kruger, and welcome back to another edition of the Best Docs Network, featuring some of the best doctors in the entire Houston area that help change people's lives, like our first doctor.
That's right, it's CT Nguyen, who helps one patient with sinus pain.
The symptoms is I had headaches, a lot of congestion, infections in the throat, a lot of mucus in the back, ear headaches, so much stuff going on.
Janice Martinez is a patient who came to my office complaining of nasal obstruction, facial pressure, constant headache. She has been treated under multiple medication, including antibiotics, antihistamine, nasal spray, without really, without any good success.
I went on, but then I started getting infections, and I was on antibiotics for 4 months in a row. They kept giving me, so I was like, this is not good.
So when we examined Miss Janice Martinez, we found that her natural sinus drainage pathway, it's obstructed by chronic inflammation, chronic infection. So we offer her the option of doing balloon sinuplasty.
The best part was that the breathing. I could breathe again. The headaches, little by little, started going away. Now when I sleep, I would breathe real loud. My husband will always say that, and I don't do that no more.
So when you have a chronic sinus disease, that passage, it's obstructed, it's narrow by chronic inflammation, chronic infection. So what we do is we put a small balloon in the passage, and we open up, we inflate the balloon and open up the natural passage, preserving the normal anatomy.
And I don't sound like I have colds all the time. Before I was like sick all the time. And now I'm doing great. I could go out, do everything, and I feel good.
One of the advantages is the quick recovery. There's really no downtime to balloon sinuplasty. The procedure can be done in office, under local anesthesia or the topical anesthesia with some nasal spray. There's not really a recovery time for balloon. The patient can go back to her daily activity the next day, and compared to a traditional surgery, which the recovery can last to a week.
I'm an athlete.
I am a World Series champion.
I'm a hockey player.
I'm a football player.
I am strong.
I am strong.
I am strong.
Fight colorectal cancer. Demands a cure for colon and rectal cancer.
I'm strong because
I have lost a friend's mother.
Because I lost both of my parents to this disease.
I am strong because nobody should suffer. Let's beat this cancer.
One simple test, and you could save your life or someone you love.
Get screened.
Be a part of 1 million strong.
October of 2011, I was diagnosed with stage 1 breast cancer and was advised that I needed a lumpectomy with internal radiation. Maybe a gut feeling kind of told me that I needed a second opinion. After looking at all my history, she actually recommended a bilateral mastectomy with reconstruction. So that's what I did on April 3rd of this year.
Breast reconstruction is a very rewarding surgery that we do for the patients. It's women who are going through some of the most difficult times in their life. They've been given a diagnosis of cancer and been informed that they may lose one or both of their breasts.
I came and talked to Dr. Feldman about the whole process, and of course I was nervous, and I know I even started crying at one point, but he was so supportive and just assured me so many times I would be in good hands and I would love the results. And
so she chose to have an expander and implant-based reconstruction, and that allows her to have a reconstruction that doesn't have a second surgical site. So rather than having to use muscle from her back or from her abdomen and impacting her golf game or her yoga or her active lifestyle, we're able to use implant-based reconstruction, which is a very nice result with really nice technology that's available to us now.
Just fabulous, yes. And he did a great job, and I had total confidence in him. And I've been feeling actually pretty good. I'm kind of wanting to get out and play golf, which I haven't been able to yet, but actually I feel really good.
Every patient has individual concerns, and whether it's lifestyle, whether it's recovery, whether it's, can they get back to their job or take care of their kids, that's something that we take into consideration with every patient. The surgery's gone so well and she's so confident with her results that she wants to be out and move on with her life and put the cancer behind her, and we've really been able to deliver her a nice result that she's able to do that with.
So many exciting things have happened since then. Not only the good prognosis with the surgery, but we're engaged now. Hopefully my daughter will be graduating from college soon, and I'll be able to retire early next year and kind of just move on with my life in a positive direction.
For more information on any of the amazing doctors you've seen on our show, just visit our website. It's bestdocsnetwork.com. Now we're going to go to our next best doctor. It's allergist Dr. Lynn Dickens.
I was pretty sick, and I'm usually a very healthy person as far as just normal activity level. And I had experienced a lot of shortness of breath, and I ended up being quite sick, but I didn't know it. And my primary care physician did some blood testing, and she found out that I had some allergy antibodies. So she referred me to Dr. Dickens.
So what we found out when we did additional blood work was that she did have a virus and several other problems, including a vitamin D deficiency, which is very common in allergic people. And we wanted to get her healthy from that before we moved on.
Of the 64 things that they tested, I probably showed up around 40. I had trees, mold, dog, cat, grasses. I was just amazed that so many things, because I love being outdoors. It's really quality of life. I expect to be able to get out and be active.
But one of the things we do as allergists, even first and foremost, is we're immunologists. And an allergy is an abnormal immune response. So we look at the whole patient and we try to make sure that we're not ignoring something, be it a chronic sinus infection or a chronic virus or something of that sort.
Since I've been treated, I think this is the first spring I haven't had a sinus infection. And I didn't realize why I was getting sinus infections, but I'm pretty sure it was the allergies.
In this part of the world, in Houston, we have just about everything. We have a lot of different allergies, and mold is a major problem. Probably not everybody needs to be skin tested, but certainly if they're having symptoms that are making them have a decreased quality of life, they're congested, they're feeling bad all the time, and they're attributing it to either their chest or their nose, definitely they should be screened.
I want to stay on my routine. It's working. I don't want to drop off of my Singular or just take it for granted, because I am my health has improved a lot. And I notice other people are struggling, and I'm just so glad I got in here before the spring allergies really hit. I appreciate their professionalism and helping me get my health back.
There are three kinds of skin cancer. There's squamous cell carcinoma. That's the kind that occurs in scaly lesions that grow in size, usually in the sun-exposed areas. There's basal cell carcinoma. Those are gray and pearly with sort of heaped up raised borders, usually again in sun-exposed areas. The most important and most dangerous skin cancer is melanoma. That's what occurs in moles. We use the ABCD rule to decide if a mole or skin lesion looks like it's bad. A for asymmetry. If the lesion doesn't look perfectly symmetric, then that's a bad sign. B for border. An irregular border is a bad sign, a regular border is a good sign. C is for color. If a uniform color occurs in a mole, that's good. If there's multiple colors or irregular colors or a change in the color, that's a bad sign. Diameter. 6 millimeters is the magic number. Anything bigger than 6 millimeters is bad, and that's about the size of an eraser. So take good care of your skin. You only have one layer.
A bunion deformity is a deviation of the first metatarsal and the second metatarsal. So basically, you know, what people see of their big toe is this. So the big toe is pointing this way, and this bone is going out this way. When it's not matching up well, you get bone growth. And so bone starts to build up right here, and it also starts to build up top.
I spend about 85% of my time traveling, so I'm in and out of the airports. As a training manager, I do a lot of facilitation. So I'm on my feet a lot walking, and it got to the point where even flat shoes, what most people would think is comfortable shoes, became painful.
Her surgery was an osteobunionectomy, but it was a little bit different because on the x-ray I discovered that she had severely arthritic joint. She had fracture fragments. So these fracture fragments never healed, and because they were constantly moving, it was severe pain. It caused an enormous amount of bone growth on the top and on the side. So I was really excited to do her surgery because I knew it would provide immediate relief.
I'll be wearing the boot for at least another 4 weeks, and then I'll come back for another reassessment. And then he'll determine then whether I can take the boot off and then just start walking in normal shoes.
People always ask, you know, why do I have this problem? And the biggest component, genetics. So if you look at your parents' feet or your grandparents' feet, it's basically telling you, if you see a bunion deformity, that your chances are your feet are going to develop these structural deformities. Then obviously for the females, it's wearing the high heels. You know, it's there's a price to pay for high fashion. You wear the high heel, it puts your foot in position, which predisposes you to a bunion deformity.
Well, I would love to be able to get back out there and be pain-free. A lot of times I couldn't wait for the day to end because I would be in so much pain. So I'm looking forward to being able to be on my feet for longer period of times pain-free.
The look on the patient's face when they come in and they see the results and they're happy with the results, and they see that instead of having a crooked toe, or that it's actually straight, and that the pain that they had before is gone. So, you know, that's the rewarding part to me.
If you've had a doctor help change your life, we'd love to hear about it. Send us an email at info@bestdocsnetwork.com.
I was experiencing chronic migraines 24/7, so 24 hours, 7 days a week. The only relief I was getting was sleep. So I would be willing to try anything. I would go to a neurologist. He tried every medicine in the book. Couldn't figure it out. He says, I met a doctor with the new procedure for stimulation for chronic migraines. Okay, let's go, let's see what happens.
The specific treatment we do here is an implanted neurostimulator for severe headaches. It's a unit that goes completely under the skin. It's somewhat akin to a pacemaker for the heart. There's a very small battery that's implanted under the skin, and from the battery, typically 4 very thin little plastic covered wires are passed up under the skin, 2 in the back of the head, and 2 of them end up right above the eyebrows. It's all under the skin. In fact, you can't see any scars or lumps. But once it's in, when it's turned on, they'll feel just a very mild tingling sensation in the front of the head and the back of the head. And by certain mechanisms, when they feel that, it very commonly either stops or dramatically improves their headaches.
After the stimulator was put in, I could see a dramatic change. I didn't have to take any medication. Except for a cold front coming in, I would just take a daily Advil Sinus or a Tylenol Sinus just to kickstart it. And then once I get my headache under control, the stimulator could take over. That's when I knew this was going to work.
Michael had these severe, basically daily, devastating headaches. Michael Parker kept on with life. He refereed the sporting events around here with the kids. So he was fighting through it, but it was still greatly limiting him. So it's been a couple of 3 years now to put it in. Michael has done great.
Whoever has migraines out there, take a look into this, because this can change your life, because it has changed mine. I would drop dead to save that man, because he saved my life.
As always, for more information on any of the fine doctors you've seen on today's show, just visit our website. It's bestdocsnetwork.com.
That, Candace, is the place to go. Right now, the place to go is our next best doctor. It's Dr. Maurice Leibman.
Probably for the better part of 10 years, when I would cough or sneeze, I would release urine.
The leaky bladder is extremely common. And I think one of the biggest issues is that women just don't like to talk about it. They think they have to put up with it, or they're somewhat reluctant to talk about it in the office to their doctor.
It finally got to the point where it was interfering with stuff. I had to carry extra underwear and clothes to work, or I'd have to go home in the middle of the day, and it was I don't think anyone ever noticed, but I felt embarrassed and uncomfortable, and that was what finally made me decide to get tested to see if my problem was due to the incontinence that this would fix.
The procedure now is also a minimally invasive procedure, and it involves placing a small piece of mesh underneath the urethra. That's the tube that goes from the bladder to the outside. And it forms just a hammock or sling underneath the urethra. And when placed correctly, it has an over 90% chance of success.
After I had it done, I told Dr. Leibman I wish I had done this 5 years ago, because it made that much of a difference. But I thought I was too young, and so I convinced myself, oh, you don't have this, it's something else. This isn't going to fix your problem, and so I just didn't ever talk to him about it. So I should have talked to him sooner.
The recovery is also just wonderful. It's done as an outpatient. This procedure is still done as an outpatient in a outpatient facility or freestanding outpatient clinic. And the patient will go home, again, have something to eat, maybe take some pain medicine, but very little discomfort associated with it.
I sneezed, nothing, not a single drop. And it's been 2 years now. I mean, it's completely changed my life.
Very little discomfort associated with it. And what's really nice about it is that it's effective immediately. If it's going to work, she'll tell you the next day she hasn't leaked, much to her surprise.
To be honest, I was kind of nervous that morning. You know, I was really nervous. I sat there and I didn't really try to think about what was going to happen, because, you know, I knew that I was fixing to go in there and have major life-changing surgery. See, I had my surgery October the 25th, 2012. This is February the 15th, 2013. So 10 days shy of exactly 4 months. And during that time, I've lost 93 pounds.
I think he's doing okay. He's in the normal range, but he could probably be doing better. And I think most of it goes to the fact that he's not putting in a whole lot of time exercising. The biggest problem we have to overcome afterwards are some of the problems that existed before the surgery.
Some of the challenges are some of the things that he was telling us about: not eating throughout the day, skipping meals, relying on fast foods. We've become so accustomed to doing those kinds of things and not planning what we're going to have and not thinking about eating. We kind of go until we get hungry, and then we want to go pick up something fast and have a quick fix. But for bariatric patients, that's just not as easy.
As far as how I feel now, I feel better, I sleep better, I move better, I get around a lot better. You know, I'm more active, and yeah.
There are 3 key elements that people, and anybody wanting to lose weight can use these also, is eating frequently. To eat frequently, to allow your body to burn the calories all throughout the day instead of loading everything on to the end of the day. Second is eating foods with protein. And third, water, drinking plenty of water. Water helps our metabolism as well.
You know, he's a young man. I think it's ideal to take care of this problem earlier in life. We already know the risk is there when we look at the patient's body mass index and their other medical problems. So there's no real sense in waiting to take care of that problem. It's better to take care of it earlier in life before it develops into something worse. And it's also better to take care of it earlier in life because they're better surgical candidates. They're going to go through the operation much easier. So.
And for more information on any of these great doctors you see, head to the website. It's bestdocsnetwork.com. That's bestdocsnetwork.com. Right now, time to head to our next best doctor. It's Dr. Paul Metz.
The ideal patients for dental implants are ones that have been through lots of restorative procedures and where these procedures that just aren't predictable. And so we were able to give them their third set of teeth with the use of dental implants.
I had an accident when I was 10 years old and I fell down on my face and I dislocated my jaw. And I didn't know that then, but I started looking for the oldest doctor or the one with 35 years or more of experience. So I went to the facility in Gessner and I saw Dr. Metz and they said, this is the guy who's gonna have to be working on you. I had to decide if I wanted to go through with it and I did research. He graduated top in the class.
So in Tico, we were able to move his upper jaw forward and set his lower jaw back so as to help line up his skeleton so that his teeth meshed together well. We as specialists in oral surgery are uniquely qualified to provide these procedures.
I just figured out this is the best facility, this is the best doctor, and I truly believe that, you know, Dr. Metz and his team, they know what they're doing.
These patients, when they come down the hallway, when we see them after this procedure, we see their level of confidence has gone up tremendously. We can tell by the smile on their face as well as their dress. They're dressed sharply and they're holding their chin up. You can certainly tell that they are happier individuals afterwards. Technology today has, really revolutionized how we practice implant dentistry. We have cone beam CTs, which allow us to take a CT of the patient in the office, and in about 20 seconds, we have 360 degrees of bone around the implant. So we know ahead of time whether we need to graft and also the type of grafting that we need to do ahead of time. So patients are better prepared for the experience and know more what to expect afterwards. We're able to do this in a safer fashion. And it's much more rapid. The procedures are much more rapid, and the recovery is much easier as well.
Here at Rivela Plastic Surgery, we perform plastic and reconstructive surgery. We emphasize aesthetic procedures, primarily of the breast, body, and face. The ideal candidate for a breast lift would be a woman who's completed their childbearing, their breast changed during pregnancy or during lactation, and they have perhaps stretch marks, excess skin, and they've lost a lot of the fullness in their upper part of their breast. So typically they're going to want everything lifted as if what a bra can do for them, and that may involve an implant or without an implant.
After birthing 3 children, I needed some help, so I came and saw Dr. Rivela. I knew some people in the area that have had his work done, or had work done by him, and so I was pleased and came to see him as well.
Amy came to us with sagging breast and after children. She wanted them uplifted. She wanted to be able to wear certain tops and clothing that looked perky without being saggy, and having to wear special undergarments that were cumbersome or bulky. So what we performed was uplift with implants, and she's turned out very nicely, and she's happy with the results.
I had friends that after I had it done looked like I had lost 10 to 15 pounds, and I had done nothing different with my eating or anything. It was just the way that the top of me was carried before versus after.
It's a fairly quick recovery after a breast lift, and it takes maybe about a month to 6 weeks to get back on your feet feeling like like you did before.
The entire office staff is wonderful. They are all very helpful. He's super nice. He is very informative, very helpful. We'll take your calls if you need to ask him any questions. He is there if he can't answer them. His nurses are there and available to you, but he is great as far as explaining everything and being there when you come out of your procedure to make sure you're okay. Yes, I would recommend Dr. Rivela. He is wonderful as far as his help and the courteousness of his staff, and his results are fantastic.
Fatigue is a very common problem. What are the causes of fatigue? Well, sleep disorders can cause fatigue. For example, if you have sleep apnea where you gasp or choke at night, that can cause you to be tired. So can snoring, so can fragmented sleep where you awaken a lot during the night. All of those can make you tired, as well as not sleeping enough hours. Taking naps can interrupt the quality of your sleep at nighttime, and therefore you're going to need another nap because you're tired. So reducing your naps will help a lot. Certain diseases can cause fatigue. For example, thyroid problems, anemia, diabetes, and hypertension. These should be checked up on at your physician's office. If you're on certain medications, some of them can cause fatigue, especially some of the medications we use to treat hypertension. Depression and stress are common causes for fatigue. For example, people who are stressed out a lot, they're going to have bad sleep, and they're just going to burn up their adrenaline during the day being stressed, and they're going to be real tired. Depression and sadness will cause you to be sleepy and tired throughout the day, so getting those diseases treated can help a lot. So if you're tired of being tired, think about the things I've talked about and try to get them checked on.
Breast cancer is a field of many specialties. I cannot do everything myself. There's the imaging and the diagnosis of cancer, and then of course the surgical part. And so not one person can take care of breast cancer by themselves.
So here at Memorial Hermann Breast Center at Southwest Campus, we really try to approach all aspects of patient care. We try to get the patient through all different disciplines, and we work as a team to do a whole approach to cancer therapy.
Dr. Rose and I met in 2000. I had been in practice for a year, and he was brought on here to develop a breast center. And up until then, it was just a general radiologist who was reading x-rays. And Dr. Rose was very different because that's all he did, was specialize in breast imaging. And as I was specialized in breast surgery, it was an immediate fit.
So it was a very awesome opportunity to collaborate with people who had tremendous experience, large experience in breast surgery and breast cancer, as well as in handling benign breast disease. And it's really very satisfying to work as a team, the surgeons, the radiologists, as well as the oncologists and radiation therapists, working closely together to give the patient the very best care that they can get.
Well, breast cancer has always been an important part of my life. My first experience was back when I was very young. My mother had breast cancer. She died when I was 13 years old. And so it's always been a part of my life, something that has been important to me. Just like Dr. Rose specializes in mammography and breast imaging, I specialize in surgery for the breast. I'm focused 100% on taking care of breast cancer patients. And that dedication and that focus really drives the quality of the surgery, and it drives the quality of the outcomes as well.
Well, that'll do it. That'll wrap up another edition of the Best Docs Network, featuring some of the best physicians in the Houston area that are helping to change people's lives.
And Candace, for people out there wanting to find out more information on any of the great doctors in the Houston area, no problem. Head to the website, bestdocsnetwork.com.
And if you have a question or comment for us, or if there's a doctor that's helped change your life, we'd sure love to hear from you. Send us an email at info@bestdocsnetwork.com.
There you go. So long, everyone. We'll see you next week.